Hello YouTube Stackers, this is ST with Silver Stacking 101. I want to jump in here with a healthcare rant and talk to you guys about the last 2 days of my life dealing with this beast we call healthcare. I'm going to tell you a story about my mother. Back in 1982, my mother was prescribed an anti-anxiety medication. I was 12 years old when she was first prescribed this medication. I'm sure that having a 12-year-old spirited boy around didn't have anything to do with the need for it, but neither here nor there. She was deemed by her doctor to need it. And her primary care physician since that time has always prescribed it. She has been on the medication continuously from 1982 until present, with the exception of when she tried to come off of it in 1994, had some problems, and went back on it. She tried to come off of it herself. Her doctor, her primary care physician, she has been seeing for 16 years, practice was sold out to the local hospital system about 2 years ago. That doctor she had been seeing 16 years had always prescribed the medication. In December, that doctor informed my mother she would no longer be able to prescribe the medication after January 1. She would have to My mother would have to get a referral from her doctor and go to a specialist, a psychiatrist, to get that particular prescription filled. Coincidentally, the specialist practice is also owned by the same hospital system. So, fine, my mother does that. In June, my mother was hospitalized with congestive heart failure. This caused my mother to miss the psychiatrist appointment after she was discharged because basically she didn't feel like going. She had been in the hospital with congestive heart failure. About 10 days ago, she saw her primary care physician, informed her physician that she was out of the medication. Now, this is medication that physician personally had prescribed for 16 years. That physician said, hospital rules, I can't write it. Well, I don't go back when my mother sees the doctor. I wasn't aware of this situation developing. I just take her to the doctor and pick her up because mom can't drive anymore. Well, mom ran out of the medication and the results started to show. The lady needed this medication. Her primary care provider would not write it, could not get another appointment to get her into the psychiatrist. And let's talk about this specialist, this psychiatrist. When we go there, it's a 29-year-old girl that's a nurse practitioner that spent 6 minutes with my mother to write her the prescription that we knew she was going to write before we went down there. It's not like The Sopranos and Dr. Melfi and sit there and tell you all your problems, end up blaming it on your parents or your kids or whatever. It was 6 minutes. A nurse practitioner was able to make an assessment that the hospital says she can make, but the doctor with 30 years experience, 16 years of which treat my mother, was no longer qualified to make. That sound right to you? So, yesterday, I'm dealing with my mother deteriorating. because without this anti-anxiety, things do not go well. So I made some calls. What can I do to get her the medication? I was advised to take her to the ER. Will they send her home with a prescription? Probably not. They probably will admit her to the psychiatric unit. The lady just needs the medication. That's it. And then I got to thinking on this whole situation. They're unbundling services because the assessment for the need of this medication should be made when the primary care physician does the assessment. It should be a concurrent action. But they're breaking it apart into 2 visits. Because mom didn't keep the second visit, we're looking at an ER visit and possibly an admission into a psychiatric ward. The lady just needs her medication. And mom has very good insurance. So I called a buddy of mine I fly with, and who is a primary care physician in another hospital's network. There is no medical need for her to go to a psychiatrist for this medication. There's no FDA law or DEA regulation that says a primary care physician cannot write it. Actually, primary care physicians write this particular medication all the time. It's a hospital rule. And it's a hospital rule designed by a bean counter like me, not for patient care, not for patient safety, not for patient convenience. It's designed to make money for the hospital. It's designed for additional revenue. I know a bean counter came up with it because I can recognize it being a slimy bean counter myself. So what do? Call a client of mine that's a pharmacist. And I explained the situation, and I said, I need a doctor that's not affiliated with the hospital, which is hard to find now because the hospital is gobbling up all the independent doctors. So the hospital systems across this nation are establishing a monopoly where this would not be an option a few years from now if the trend continues. I need a doc that was local, I could get into, I could get this prescription, the situation will be fine. And luckily my client knows the doctor well, got in today, got the prescription, day or so, life's going to be good. But this was turning a very simple situation into a very complex situation by the hospital system unbundling the services, billing the insurance for 2 different visits. So now we got a specialist visit, which is really a visit with a nurse practitioner and the primary care physician, where the primary care physician is more than qualified to make the decision. It's frustrating to me, folks. We talk about runaway medical expenses. Stuff like this is part of the reason. Now, I wasn't trying to be a good consumer and save my mom's insurance company money by doing it this way. I'm not going to claim that. I was trying to get my mother the medication so everything would be fine. But when you're dealing with a 77-year-old already in bad health and having to comply with some bean counter's rules, and I say that's a slimy bean counter that doesn't know crap about medical stuff, it's dangerous. This is not set up for the patient. This is set up for profit. And that pisses me off. Thank you for letting me rant. Good day.